We begin with valley fever season. It's here, but it's different this year than previous years due to the extremely wet winter we had. 23 ABC's Ruby Rivera explains why medical experts believe drastic change in weather can cause an increase in valley fever cases.
According to data from the California Department of Public Health, since 2019, Kern County has been ranked as the county with the highest number of valley fever cases. And with the weather we've experienced so far, health officials say stocking up on supplies now is the best form of preventative action.
Valley fever can show up as a mild respiratory illness, just like a cold. And people often can get that level of illness and never know that that's what it was, and it can resolve on its own.
Dr. Frank Lang, Kern County's Assistant Chief of Medicine at Kaiser Permanente, says although valley fever can go away on its own, it doesn't mean you should be quick to dismiss it. According to the California Department of Public Health, 2019 had more than 9,000 cases reported statewide. 2020 had more than 7,000 cases, and 2021 more than 8,000 cases were reported. Looking further into those numbers, Kern County had roughly 3,300 cases in 2019, 2020 had 2,600 cases, and 2021, 2,800 cases.
It tends to live in what's called the Sonoran Desert area, which includes the southern San Joaquin Valley. It moves its way over to the Mojave Desert area and on into Arizona.
Dr. Lang says Kern County is more susceptible to valley fever due to how much open land we have. Division Director of Health Services at Kern County Public Health, Kimberly Hernandez, says on average 60% of people won't get symptoms. However, the other 40% won't be as lucky.
They may have a fever and a cough, shortness of breath. Some people get night sweats or chest pain, joint and muscle pain. There's a very specific rash that sometimes develops for some people.
Hernandez says administering antibiotics is the earliest form of treatment, although it may not be necessary for everyone. She says valley fever doesn't have a target, although people with compromised immune systems, pregnant women, or anyone on medication are more likely to get it.
Precautions around valley fever are reducing your exposure to dirt and to dust. And so, one of those big ones, if it is windy and dusty outside, you can avoid being outside, then stay inside.
Dr. Lang says while this is an ideal solution, this may not work for everyone and urges anyone to continue wearing masks to reduce the spread of dust into their lungs. He says it's also a good idea to wet the dirt with water before working outside to limit the spread of dust. Dr. Lang says although valley fever is compared to the common flu, it does have the potential to be deadly and should be taken seriously.
It can spread to the bone marrow, it can spread to the brain. It can often require lifetime treatment in those respects, and it can actually kill people. So it's one of those things to take seriously.
Although studies show that valley fever is more common for people between the ages of 55 and 78, anyone with a compromising immune system is at risk of catching it. For more information on how to avoid valley fever this year, visit our website, turn23.com. In Bakersfield, Ruby Rivera, 23 ABC News, connecting you.
Looking further into valley fever, which is something that not only impacts people but animals as well. According to the CDC, pets, especially dogs, can become infected. However, it's not contagious between animals and people. Dogs that develop symptoms will cough, have a lack of energy, and lose weight. If you're concerned your pet has valley fever or is at risk for it, talk with a veterinarian.